All right, so cholesterol is a substance that puts you at high risk for developing heart disease and a stroke. Over 71 million Americans have high cholesterol. Only 1 in 3 people with high cholesterol have it under control. Our health expert, Dr. Kevin Campbell, here this morning to break it all down. Doctor, good to see you again.
Good to see you.
What exactly is cholesterol?
So cholesterol is a substance that our body produces, and it's very important in building the membranes or the walls around cells.
Right.
It's also important in hormones that help our body communicate to different parts of the body and different systems. But cholesterol can be a real problem when it comes to cardiovascular disease.
Right. There's good and bad, right? Cholesterol, explain that.
There is. We have numbers that we look at. Total cholesterol, which we want less than 200. Then we have LDL cholesterol, which is the bad cholesterol, and we want that number less than 100. Then there's good cholesterol, which is HDL. That number we want more than 40. And HDL can really be improved by exercise. That's one of the mainstays of raising your HDL. And in fact, HDL protects us from heart disease.
All right, good to know. And you as a cardiologist, I'm sure you see a lot of this come in and out of your office every day. How do you test for it?
We see this every single day, and I personally have high cholesterol that I take pills for.
Right.
The best way to test for cholesterol is get a blood test when you're fasting, and that can give us an idea of where your numbers are. Once we know what your numbers are, sometimes we have to do a special test that breaks down the size of the particles, meaning within the LDL cholesterol, how much of the really, really bad cholesterol do you have?
Okay, and what about treating it real quick?
We typically treat this with diet and exercise, like the Mediterranean diet we talked about last week, and also with medicines called statins, which stop the body from producing cholesterol and actually can make us live longer.
Good to know. Doctor, always good to see you.
Good to see you.
Thank you
for
so
being
much.
Here.
And of course, if you have a question for Dr. Kevin Campbell, to ask him, it's real easy. Log on to our website, WNCN.com, search the links we mentioned section. From there, you can find Dr. Campbell's website, or you can also like his Facebook page or hit him up on Twitter.